Cervical cancer is a type of cancer that occurs in the cells of the cervix. It is one of the most common cancers affecting women worldwide, but it is also one of the most preventable types of cancer. The cervix is the lower, narrow part of the uterus that connects to the vagina. It plays a crucial role in the female reproductive system, acting as a passageway between the uterus and the vagina. This cancer develops when cells in the cervix grow abnormally and invade nearby tissues. These abnormal cells can multiply uncontrollably, forming tumors and potentially spreading to other parts of the body if not detected and treated early. Cervical cancer often develops slowly, starting as a precancerous condition called dysplasia. Dysplasia refers to the presence of abnormal cells on the surface of the cervix, which can eventually turn into cancer if left untreated. Dysplasia can be detected through regular screenings and treated to prevent it from progressing to cancer. The most common screening test is the Pap smear, which can identify abnormal cells before they become cancerous. The human papillomavirus, or HPV, is a common sexually transmitted infection that is a major risk factor for cervical cancer. There are many different types of HPV, but only some of them are linked to cervical cancer. However, it's important to note that not everyone infected with HPV will develop cervical cancer. Many HPV infections go away on their own without causing any health problems. Regular screenings and HPV vaccinations can significantly reduce the risk of developing cervical cancer. There are two main types of cervical cancer: squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma begins in the thin, flat cells, known as squamous cells, lining the outer part of the cervix. This type is the most common, accounting for about 80% of cervical cancer cases. Adenocarcinoma starts in the glandular cells that line the cervical canal, which is the passageway through the cervix. Although less common overall, adenocarcinoma has become more prevalent in recent decades. In its early stages, cervical cancer often does not cause any noticeable symptoms. This is why regular screenings are crucial. As the disease progresses, women may experience abnormal vaginal bleeding. This can include bleeding between periods, after intercourse, or after menopause. Other symptoms may include unusual vaginal discharge, pelvic pain, pain during intercourse, and changes in bladder or bowel habits. If you experience any of these symptoms, it's essential to consult a healthcare professional. Early detection is essential for successful treatment of cervical cancer. Two primary tests help diagnose cervical cancer: the PAP test and the HPV test. The PAP test, also known as a Pap smear, involves collecting cells from the cervix and examining them under a microscope for abnormalities. It is often part of a routine pelvic exam. The HPV test detects the presence of high-risk strains of the human papillomavirus. Both tests can be done simultaneously. If abnormalities are found, further testing such as a colposcopy or biopsy may be recommended. Section 5. Staging. Understanding the progression. This section is crucial for comprehending how cervical cancer develops and spreads over time. If cervical cancer is diagnosed, it's essential to determine the stage of the disease. Staging helps doctors plan the best treatment and predict the patient's prognosis. The stage indicates the extent to which the cancer has spread. It provides a roadmap for understanding the severity and spread of the disease. Stage 1 is the earliest stage, where the cancer is confined to the cervix. At this stage, the cancer is usually highly treatable with a good prognosis. In stage 2, the cancer has spread beyond the cervix to nearby tissues, but not to the pelvic wall or lower part of the vagina. This stage may require more extensive treatment, including surgery or radiation. Stage 3 indicates that the cancer has spread to the pelvic wall or lower part of the vagina. At this point, the cancer is more advanced and may cause symptoms like pelvic pain or urinary issues. In stage 4, the most advanced stage, the cancer has spread to distant organs, such as the bladder, rectum, liver, or lungs. This stage is the most challenging to treat and often requires a combination of therapies, including chemotherapy and targeted treatments, to manage the disease. Section 6. Treatment options. A multidisciplinary approach. This approach involves the collaboration of various specialists to provide the most comprehensive care possible. Treatment for cervical cancer depends on several factors, including the stage of the disease, the patient's overall health, and their preferences. Each patient's case is unique, requiring a personalized treatment plan. Treatment options may include surgery, radiation therapy, chemotherapy, targeted therapy, and sometimes even immunotherapy. Often, a combination of these approaches is used to achieve the best possible outcome for the patient. The multidisciplinary team works together to tailor the treatment plan. Surgery may involve removing the tumor, the cervix, or the entire uterus. This is often considered when the cancer is localized and can be physically removed. Radiation therapy uses high-energy rays to kill cancer cells. It can be used alone or in combination with other treatments to target cancer cells that cannot be surgically removed. Chemotherapy uses drugs to kill cancer cells. These drugs can be administered orally or intravenously, and they work by targeting rapidly dividing cells. Targeted therapy uses drugs or other substances to identify and attack specific cancer cells. This approach minimizes damage to normal cells and can be more effective for certain types of cancer. Immunotherapy helps the body's immune system fight cancer. By boosting the immune system, it can recognize and destroy cancer cells more effectively. This is a promising area of treatment that continues to evolve. Section 7. Risk factors. Identifying potential threats. Several risk factors can increase a woman's likelihood of developing cervical cancer. The most significant risk factor is infection with high-risk strains of the human papillomavirus, or HPV. Other risk factors include smoking, having a weakened immune system, and having a family history of cervical cancer. Early age at first sexual intercourse, having multiple sexual partners, and certain medical conditions, such as chlamydia infection, can also increase the risk. Section 8. Prevention. Your best defense against cervical cancer. Cervical cancer is a preventable disease. Vaccination against HPV is highly effective in preventing infection with the virus strains that cause most cervical cancers. The HPV vaccine is recommended for girls and boys starting at age 11 or 12, but it can be given as early as age 9 and up to age 26. Regular cervical cancer screenings, including Pap tests and HPV tests, are essential for early detection and treatment. Practicing safe sex, including using condoms, can also reduce the risk of HPV infection. Section 9. A final word: knowledge and action for a healthier future. Cervical cancer is a serious disease, but it is often preventable and highly treatable when detected early. Understanding the risks, getting vaccinated against HPV, and adhering to recommended screening guidelines are crucial steps in protecting your health. Knowledge empowers us to make informed decisions about our health. By taking proactive steps, we can significantly reduce the impact of cervical cancer and pave the way for a healthier future.